Hello and welcome to episode 114 of the Veterinary Behavior Chat podcast. So today we've got a pretty big topic, and the reason I have decided to do an episode on this topic is because I've had quite a few people ask me to speak about this recently. So I've been invited onto a different podcast to talk about the same topic, and I've had a couple of people ask me also through our social media channels or by contacting me directly to do an episode on this. So I thought I would dive into it because it's actually quite a big one. I think it's potentially something that we're either seeing or recognizing more of. And that is hyperactivity, also known as hypersensitivity-hyperactivity, so HSHA, or hyperkinesis syndrome in dogs. And I say, are we seeing it more, or are we just recognizing it more? Are we perhaps, not meeting our dog's needs as well as perhaps we should be? So I think some of those things I'm going to dive into a little bit deeper. But I definitely see more professionals talking about it, and I definitely hear more questions being asked about it. Now, I am going to kind of go through step by step. I'm going to kind of talk about behavioral science first. I'm going to talk about some of the different classification systems we have. I'm going to talk about differential diagnoses. How do we actually make a diagnosis? I'm also going to talk about what is hyperactivity not, but what could the comorbidities be? And then I'm going to talk a little bit about how we might treat these cases. So what I just want to start off by saying is what I'm not talking about. So there are a couple of other sort of, I guess, definitions or perhaps even diagnoses and words that are maybe sort of thrown around or bandied around quite a lot that I think I'm not talking about in this particular episode. So one of those would be hyperarousal. So I'm not talking about hyperarousal. I'm also not talking about impulsivity. I'm also not talking about frustration in this episode, although all of those things can be comorbidities, can kind of occur at the same time as hyperactivity, can be kind of part of the presentation. But I think it's important that we do try and sort of differentiate these things a little bit. I also want to be really clear in saying that I'm not talking about the human diagnosis of ADHD or ADD, because we don't have that distinct definition or classification in the veterinary behavior world. I'm going to say yet, who knows, it might come. And I also know that there's quite a lot of conversation and discussion about, should we be labeling our pets with some of the same diagnoses that we give to people? I think perhaps we can't necessarily know what our dogs experience exactly. We can only observe what we see and try and understand or, make some kind of sense of what we are seeing. However, I think when we're talking about sort of ADHD and perhaps the autism spectrum in humans, that's so much more involved. I'm not going to say complex because that would be doing our dogs a disservice, but I don't think we can compare the two just yet. And I don't think that we should be using the same terminology. Like I say, that might change in the future, but where we are right now, I don't think that is helpful. So what I am talking about today is hyperactivity, this HSHA, which we sometimes talk about, which is actually comes from the French classification system, which is hypersensitivity-hyperactivity syndrome. And that has a couple of unique features that I'll talk about. And then something called hyperkinesis syndrome, which has also been described in dogs. So what am I even talking about? What are the behavioral signs that we see when we're talking about these types of classifications? Well, as you can imagine, when we're talking about hyperactivity, the first thing would be extreme motor activity. So just extreme movement, extreme kind of, whether that's walking, running, pacing, other types of motor activities or movements, but in an extreme way. We're also talking potentially about inattention to signals, so not being able to focus or respond to certain cues or signals, so a lack of focus. Sometimes we're talking about things like vocalizations. We're potentially talking about abnormal repetitive behaviors. So this is something that has been talked about in working dog circles quite a lot. So, and I'm talking sort of military working dog circles. So things such as spinning or even tail tip injuries as a result of this hyperactivity. In these circles, we could also be talking about disruption to work because of this inability to focus and this inattention to cues, and potentially also reduced social relationships. And another really big thing that we do talk about in this context is sympathetic arousal, so high sympathetic arousal. So now we are back to, is it hyperarousal? Is it hyperactivity? And you start to see where it starts to become a quite interwoven and quite complex. But certainly when we're talking about this hyperactivity or hyperkinesis syndrome, we are talking about extreme sympathetic arousal, and that can be an increase in heart rate, potentially an increase in respiratory rate, and this lack of calm behaviors. So those are the sort of behavioral signs that we're seeing. And I'm going to dive even deeper into some of those in a second when we talk about differential diagnosis. Let me talk a little bit about the French classification system, though. So this is something that I studied when I took my European board exams. It's not something that's talked about a lot in the American system, although there is definitely knowledge of it and kind of acknowledgement of it. But the French classification of HSHA, so hypersensitivity-hyperactivity syndrome, they kind of specify three big things. The first is, again, this overdeveloped motor activity. The second is reduced sleep, which is interesting. And the third one is poor satiety, which is also really interesting. So these dogs that are constantly hungry. And I myself, really early on in my residency, sort of within my first 100 cases that I saw a beagle who was absolutely sort of very classic for these signs. So this overdeveloped motor activity, being really just not being able to stop almost. And this dog had really poor satiety to the point where he was eating literally anything that came in his way, but with an intensity that was extremely atypical. So that would be the French classification. And they do have a couple of different stages. I'm not going to dive too deep into that. If you are interested in looking that up, there is a chapter in the older edition of the Landsberg, Hunthausen, and Ackermann textbook of behavior problems of the dog and cat that kind of dives into stage 1 and stage 2 and sort of classifies this a little bit more. But I'm going to not dive too much deeper into this, but just kind of leave it with these three sort of big cardinal signs of overdeveloped motor activity, reduced sleep, and poor satiety in the French classification system. Okay, so what if we're presented with a dog where we might suspect that hyperactivity could be either our main diagnosis or certainly one of our diagnoses? What are the differential diagnoses that we need to think about? Like, what are all the different possibilities that we need to really take into consideration? Well, the first is that this could be normal for this individual. So again, in the new version of the Landsberg-Rodoster textbook, clinical behavior or behavior problems, of the dog and cat, they state that up to 20% of dogs naturally manifest high levels of activity. So we could have a normal expression of behavior for an individual patient that is presenting to us. And then, of course, we have to take into consideration breed predisposition. So we're thinking specifically about our working dogs, our German Shepherds, our Belgian Malinois, our Border Collies, our working dogs that might just have naturally a higher activity drive. It could also be due to reinforcement history. So it's possible that dogs have been positively reinforced or have been reinforced for high levels of activity, therefore they perform them more. And then, of course, it could be due to lacking exercise, so under-exercise, whether that's for the individual or for the breed, or perhaps for an individual that has a higher activity drive, so under exercise, not enough physical exercise, and then lacking stimulation. That could be mental stimulation, that could be breed-specific stimulation. So all those things are differential diagnoses that we really have to question. We really have to dive deep here and understand what that dog's everyday life looks like, to understand, is this normal or is this truly sort of an abnormal presentation of behavior? And then, of course, we have lots and lots of medical differential diagnoses as well. So hyperthyroidism, which is really rare in dogs, however, not unheard of. So hyperthyroidism, we sometimes see that in dogs that are being fed raw food, where the whole animal is being used in the production of that raw food, where we might have thyroid gland containing thyroid hormone as part of that raw food presentation. So hyperthyroidism is something to look out for. Of course, neurological disorders, pain can absolutely manifest as inability to settle, excessive pacing, panting, all that sort of activity patterns there. Cognitive dysfunction syndrome, another really classic one where we might see increased activity, again, oftentimes presents as, sort of pacing and walking around, not being able to settle, getting up, moving again. And that can be truly cognitive dysfunction, or it can be in combination with pain in our older patients. And then other sort of neurological presentations, such as hepatic encephalitis, neuropathic pain, lots and lots of different sort of physical medical differential diagnoses to think about. So we need to think about that. And then we might have comorbidities or other differential diagnoses. So we could have fear or anxiety. Generalized anxiety disorders can often present together with hypervigilance, scanning, patrolling, again, inability to settle. So looking for other signs of anxiety, other presentations aside from the activity that could be kind of pointing towards generalized anxiety disorder. Our abnormal repetitive behaviors, of course, would be in there. Attention-seeking behaviors, whether that's either been reinforced or whether that comes perhaps from anxiety, again, can be, inherent with this sort of increased seeking behavior, following behavior, therefore heightened activity. Sometimes we can have aggression as a comorbidity, and that can be a result also of these other words that I was kind of talking about: hyperarousal, frustration, impulsivity. So they can sometimes be really complex pictures, and we can have a patient that's presented to us where we might be suspecting something to do with hyperactivity, but we really need to dig deep into what else might be going on. Okay, so we now know all the other things we need to be thinking about. How do we now actually make a diagnosis? And this is super interesting because we've got a couple of different ways in which we can do this. And I'm going to refer to Dr. Karen Overall's chart that she has come up with, which is a really nice way of looking at things from a behavioral presentation point of view. So Dr. Karen Overall kind of looks at this hyperactivity sort of presentation as potentially having 4 or 5 different categories, let's say. And depending on how the dog presents behaviorally, they're more or less likely to fall into one of these 5 categories. So the 5 categories that Dr. Overall describes are overactivity, generalized anxiety disorder, true hyperactivity or hyperkinesis, hyperreactivity, and then attention-seeking behavior. And again, you can use these categories to just help you a little bit narrow down or think about where your individual patient might sit more. So Dr. Overall describes overactivity as being a dog that is very active, perhaps even overly active, but that can settle and relax in appropriate times, such as at bedtime, for example. And oftentimes this overactivity can resolve when we increase activity levels. So it's a little bit about meeting those needs, meeting those activity needs, and then creating a situation where the dog can settle and where we then have a calm, relaxed dog. Then we have generalized anxiety disorder, and sort of, according to Dr. Overall, some of the typical signs that we see with that might be this increased vigilance and monitoring that I described earlier, scanning, patrolling, that sort of thing. We see distress. We see more distress in this generalized anxiety disorder. And we can sometimes also get physical signs of anxiety, such as maybe diarrhea or maybe excessive licking, self-licking of the paws or something like that. So we might see other signs in there. With hyperactivity or hyperkinesis, so true hyperactivity and true hyperkinesis, according to Dr. Overall, this is where we have signs of sympathetic arousal even when the dog is resting. So even when the dog is in a state of rest, which might not happen very often, we've still got heightened sympathetic arousal. So heightened heart rate, heightened respiratory rate. And I'll talk a little bit more about this in a second. But so that's something that's quite typical of this sort of hyperactive or hyperkinetic state. Hyperreactivity, on the other hand, again involves sympathetic arousal, but only in response to a triggering stimulus. So again, the dog can settle when the triggering stimulus is not around, but then when the trigger is around, we get again this heightened arousal, and we might initially not have distress signs, but that might generalize to distress signs going forward. So that would be hyperreactivity. And Dr. Overall includes things such as vocalization, again, this extreme motor activity, inattention to signals and signs, lack of focus, but specifically when we have a triggering stimulus present. And then attention-seeking behavior. I don't know, I'm a little bit on the fence about this attention-seeking behavior. But again, Dr. Overall has sort of classified it here. She also says that distress can be a primary sign here. So it's this sort of connection and perhaps even hyper attachment to the caregiver, and this sort of seeking of, social reassurance, if you like. So again, we can have signs of distress when that's maybe not present, when that social comfort isn't present, and the dogs can settle when that social comfort is present. So that is quite an interesting way of looking at it from a sort of a behavioral sign perspective. But the other really interesting way to diagnose this comes really again from these military working dogs, where quite a lot of work was done with hyperactivity and hyperkinesis. And there we actually have what we call a stimulant response test. Now, when we say stimulant, we're talking about stimulant medications. So things such as amphetamines or methylphenidate, which many of you may know as Ritalin, so the treatment that is often used in ADHD for humans. And the idea behind this stimulant response test is that in true hyperactivity or hyperkinesis, the neurotransmitter systems that are said to be involved are the dopaminergic system, but also the serotonergic system, and potentially also, but maybe to a lesser degree, the noradrenergic system. And because stimulant medications target all three of these neurotransmitter systems, in particular also the dopaminergic system, which we don't really have a lot of medications that do target the dopaminergic systems, this stimulants response test is something that can be quite indicative and is used to make a diagnosis. Now, I think it's really, really important to say that these stimulant medications are not suitable for treatment. I've had a bunch of colleagues that have tried using things such as methylphenidate for dogs with hyperactivity, and there are a number of problems with them. They may be initially effective, but they are traditionally really short-acting in dogs. So you might get a couple of hours of improvement, and then you're back to the same behavioral signs and the need to either potentially redose or use these stimulant medications in a way that maybe is not suitable, I think, for our canine patients. So stimulants as a treatment for this are not great in veterinary medicine. Certainly, we haven't found any medications yet that have been a good option for this. However, as a way of diagnosing, they can be really useful. And there are a couple of different protocols that can be used. So one of the protocols that is used is to use dextroamphetamine, and it's given to the dog, and then the dog is observed every 30 minutes for a period of 2 hours. And the things that we are looking for are decreases in heart rate, decreases in respiratory rate, and overall calming of motor activity. And there's actually a really nice way to do that, to look for whether motor activity is actually reducing. And that is to have these kind of almost gridded activity areas or gridded areas. So that could be, I don't know, an area of lawn or grass, or an area of an outside area, where you basically create a number of different grids and you score how many times the dog enters or exits that certain square within that grid. And what you should see over time is that at the beginning, the dog is so active that it frequently is present in pretty much all of the squares of the grid, and that over time, as the dextroamphetamine starts to have effect, we see that calming of motor activity, and we see the dog being a lot less active and being a lot less present in each of those different squares of that grid. So that's one way of actually getting some data and some measurement on whether the medication is having the effect that we are expecting it to have, in that it actually reduces and calms this motor activity. And then again, there's another protocol for methylphenidate for Ritalin, which is actually over a period of 3 days. And again, we're looking of reduction in these sort of sympathetic signs and the sympathetic arousal. And again, heart rate, respiratory rate, and reduced motor activity are always the things that we're looking for. So that is, if you really want to like dive deep, and if you're really sort of suspicious of hyperkinetic syndrome or this hyperactivity syndrome, then using these stimulants in order to obtain a diagnosis may or may not be useful. And remember, they're not medications that are intended for long-term use or treatment of the condition. So that is kind of a way of diagnosis. So we've talked a little bit about the differential diagnosis, all the things that we need to be thinking about. We've kind of talked about how to actually get a diagnosis, both from a behavioral sign point of view, as well as from potentially using this stimulant response test if we are so inclined to do so. And let's say we now do have a diagnosis of hyperactivity or hyperkinesis. What are our treatment options, and how can we help these patients? So if we go back to thinking about our neurotransmitter systems, which, as you all know, I love, and we mentioned that we have dopamine, serotonin, and noradrenaline, all of those three neurotransmitter systems potentially involved in this kind of syndrome, then one medication that might be quite useful is selegiline, which is a monoamine oxidase inhibitor and actually targets all three of those neurotransmitter systems and increases the levels of all three of those neurotransmitters. So that's definitely something that has been recommended, and that's also in the literature. And we use the once a day dose of selegiline of 0.5 to 1 milligrams per kilogram given in the morning. So that is definitely something that can be used from a psychopharmaceutical point of view. The other thing that we can use from a psychopharmaceutical point of view, where we do have literature, is a high dose of fluoxetine. And by high dose, we mean 2 to 4 milligrams per kilogram, which is a high dose. There is a paper to support this. So this is the work of Sylvia Masson and Stephane Bleuer-Elsner, both diplomats of the European College of Veterinary Behaviorists. And it is a paper that came out in 2021, and it's called Effective Fluoxetine at a dose of 2 to 4 milligrams per kilogram daily in dogs exhibiting hypersensitivity-hyperactivity syndrome, a retrospective study. So it's a retrospective paper that has looked at, or that looks at dogs that received this medication at this dose, and found that there was definitely improvement in signs at that dose, but also found that 61% of the dogs in the study had adverse effects to this high dose of fluoxetine. They say of varying degrees. Many of them were not severe signs. However, that's something to be aware of. So yeah, we don't have great psychopharmaceutical treatment options. The stimulants we can't really use long-term. Selegiline might be an option, but potentially, we have to be mindful when we use any psychopharmacological agent, but selegiline certainly. And then fluoxetine at this very high dose, but comes with adverse effects in 2/3 of dogs that were in this study. So yeah. What else can we do then? Well, I think absolutely meeting needs is a big one. Creating good opportunities for sleep. And if you haven't yet, have a listen to my podcast episode on sleep that I did with Dr. Carrie Tooley. So how can we provide a really great environment for rest, for sleep, using calming and relaxation protocols, making sure that physical needs are met, making sure that mental and emotional stimulation needs are met, that behavioral needs are met. And then, of course, we need to rule out all of our physical medical differential diagnosis. So really diving deep into whether we have anything that might be causing this restlessness. So again, pain is a big one. In older patients, I would absolutely be looking at cognitive dysfunction, and their selegiline might also be the treatment of choice. So that might also be a nice way of kind of treating these particular patient groups. But yeah, those would be, all the things to think about. Making sure that we really provide all opportunities for settled, calm, relaxed, physiological relaxation, reduction of arousal, licking, sniffing, chewing, all those behaviors that we know potentially decrease heart rate, decrease sympathetic arousal, and of course, all the other things we've talked about in terms of meeting physical exercise needs, meeting behavioral needs, and so on. So that was a bit of a whistle-stop tour through hyperactivity and hyperkinesis syndrome, hyperactivity or hypersensitivity-hyperactivity, HSHA syndrome. I'm going to do some other episodes on hyperarousal, frustration, and impulsivity, because I think they're related, but I also think they're different. So I think it's really important to understand what the differences are and what the similarities are, and how they might co-present and how they might be comorbid, and how we might kind of think about, moving forward with treatment plans and so on. But yeah, I thought I would tackle this one because, there's just been so much conversation about this particular topic. So many people have asked me separately, independently, to talk about this. So this was your episode on hyperactivity, HSHA, and hyperkinesis syndrome in dogs. So I hope you enjoyed it. Let me know if you've got any questions, any comments, pop them in the show notes. I will put the link to the paper that I mentioned by Bleuer-Elsner in the show notes as well, so you can have a look at that. I will also put a link to my psychoactive course if you're interested in learning more about psychopharmacology. And I'll also put a link to my 30-minute vet to vet or vet to pet care professional consults in case you have a case like this and you'd like some help and support with it. I think they're really tricky cases to manage, and I think they're really tricky for the caregiver to live with as well. So I think they require quite a lot of sort of comprehensive support from all different avenues and angles. All right. I hope you enjoyed this episode, and I look forward to seeing you next week for episode 115. Bye for now.